would ask my patient, okay, may I use this on you, please? So a gait belt is required. So my patient will be a left-sided hemiparesis, okay? I would start with the front approach first. Okay, so with the front approach, I'm gonna use it for modern max assist. Okay, a patient with cognitive problems, a patient with shoulder subluxation. Okay, at the early stages of the rehab, it's preferable to approach your patient from the front. Okay, so they can feel safe when you do that with them, right? So approaching the patient from the front means that, okay, I'm gonna have her feet first, kind of a little bit of more than normal base of support. Okay, make sure that the affected head is not externally rotated. Okay, because this would be the problem when our patients they start to sit on the table or sitting on a chair. They would have, because of weakness of that affected side, this would be the fall. Okay, so make sure that the foot is on the floor. It's not supinated. Okay, the affected shoulder or the affected arm should be protected too. Okay, so my foot placement right here, as we mentioned last time, would be the same. With all our techniques, approaching the patient from the front, here we go, that is my position. And also remember that I pushed her heel a little bit outside. So making sure that the leg is not externally rotated there. Okay, so I have two opposite forces right now actually. The first one is here, I'm grabbing her in, and this foot is supporting her to the heel to be kind of like neutral or a little bit left. Okay, the other foot, if your patient is bilaterally affected, like a patient with TBI, okay, I have to put it there. Same thing. Okay, so you can feel my forces here, right? So one is getting this in, the other one is getting the heels out. All right? So let's say she is only unilateral, which is the left side. So with the left side here, okay, with the right side, I can pick my foot off. It's not a big deal here. Okay, she doesn't need any support for this leg. Okay, she has maybe a good muscle strength there. Okay, so if you want, you can use it. It's an option here. So having it there or not, that's up to you. Okay, but the affected side has to support it like this way. Okay, the affected shoulder, I would have it just on my shoulder here. So the patient now is kind of this limb, she cannot control it at the shoulder, right? So it may fall. If it falls and it's heavy, more subluxation here, right? So to avoid this, I would have her both arms on my shoulders, all right? This would help her also, the leaning forward. Look, I'm not going to do this with her, right? My hands, oops. Okay, so here's my hand. I'm trying to get the muscle, all right? So my other hand will be the same thing. underneath the gait belt here, okay? It's limiting me a little bit, but I can now facilitate the lumbar extensors. I can facilitate the glutes if I want to, okay? So now we mentioned that the flexion is where at the hip joint, right? So having her lean forward, I am facilitating now the back extensors. All right? So I'm gonna ask her to lean forward, so having the nose over the toes, and on the count of 3, we're gonna stand up. 1, 2, and 3. She's trying to lean to this side, okay? And now, stand straight, please. Nice and tall there, okay? Having the weight a little bit to the right. The left, sorry. To the left. It's kind of afraid that would happen, okay? Okay, but that's great. She's still leaning forward. Facilitate more and get her standing. Now she's really using my support, okay? At the knee joint, right? And you can start the weight shaft here, okay? Your patient would always like to lean to this side and go there, okay? Lean forward to have the knee straight. But you can facilitate that. You can control the whole body here at the level of the COG, right? So leaning to that side, okay? And now my hand, stand straight, nice and tall, that's it. Okay? So to get her into sitting again, I'm gonna move my hand, facilitate the hip flexors on that side, not on that side, all right? So here, again, move my hand from posterior to anterior, here, and ask her to lean forward again, bend your knee slowly, okay? And now we're going to sit down. Controlled bend. Okay? Let's do it again. So here, she's leaning forward on me, okay? I'm making sure that the lumbar spine is straight, okay? And now I'm gonna ask her on the count of 3, we're gonna stand up. So 1, 2, and go. Here, good, okay? And she's leaning to the right. Gonna help her a little bit with the weight shaft to the left side. Stand nice and tall, straight please, that's good, okay? So to facilitate the sitting down, okay, move my hand forward, okay? If she continue to, before we do this, if we continue leaning forward, this hand can move to here, just below the clavicle, get her standing straight, but not much, okay? Just get her to neutral, okay? Still, this hand would go again, facilitating the hip flexors here. Ask my patient to lean forward, okay? Flex your knees, bend them, slowly, slowly, and sitting down, okay? So, some patients, due to spasticity at the quads, you may need to go facilitate the knee flexion. Okay? So, yeah, this is common. Quads spasticity, even severe osteoarthritis of that knee, once they are standing, the knee would be locked. Okay? To facilitate the unlocking of the knee, you need to facilitate the hamstring on that side. So this hand should be moving up and down without any problem. Okay? All right. So this is when we are doing that with early patient, Motomax assist, patient with cognitive, patient with shoulder subluxation. Okay? You can tell that she's now sitting on the edge, and you control it, or you need to scoot backward. Okay. So if your patient is like that, not able to do it, okay? Last time we learned how to scoot them back, right? Okay. But I needed that now for the side approach. For the side approach, I'm here. We mentioned that last time, right? Okay. So for approaching the patient from the side for postural corrections, if you remember, we did this. Okay. It's gonna be hard to use this with a patient with MOD and Max Assist, the side approach. those people, they would not have a good trunk control. So approaching them from the front would be very much easier for them than approaching them from the side. And the leverage also, if you want to do this, it's not that big, right? My other leg is here. All right? So bracing her knee, supporting that, and also this would be preventing her from sliding off the table. Okay? The affected shoulder can be placed here. Okay? And now I'm gonna ask her to sit nice and tall. Okay? And this would be for a min-assist patient. That would be very easy for them. Okay? And still my hand is not on the gate belt, underneath the gate belt. Okay? So I'm gonna ask her to lean forward, have the nose over the toes, and she can do that 1, 2, and she's gaining momentum. And on the count of 3, we're gonna stand up here. So my hand now, she's going there. Okay? So with this, I'm gonna have her knee supported and the weight more to this side, and please stand nice and tall. Okay? I'm not supporting much right now, okay? So make sure that if she needs that support, you support her. Okay? So now if she leans to my side and the knee got buckled, okay, you are there to support. Okay? You can change your hand, your foot position to get her supported like that. For getting to setting again, I'm gonna ask her my hand on the hip flexors, okay? And ask her to lean forward, okay? Bend your knees. So now her knee on that side again may be locked in this position, right? So I can move my hand to get her up there, okay? That a little bit of deflection, lean forward, okay? And sit down slow. All right? Let's do it again. Okay, so now we're gonna do kind of gaining momentum. So lean forward. The count of 3, you're gonna stand up. 1, 2, and go. Stand straight here. Okay. This leg, this hand could be facilitating quads too. Okay, by tactile stimulation. We are still at the cognitive stage. So at the cognitive stage, you can use visual, tactile, or proprioceptive feedback, right? So here, having her in this standing, okay, you can start doing this kind of weight bearing, weight shifting on her both legs, okay, in this position. And always ask your patient to stand straight, nice and tall. And for sitting down, okay, I'm gonna start facilitating the head flexors. If needed, facilitate the knee flexors. And then you go slowly, control length. Okay? And this stroller should be back to her lap, okay? Without any trauma to the capsule. Okay? Questions about these 2 approaches? Okay, let's practice them.